Great to be here at the Social Entrepreneurship track. And we would like to use these few minutes to hear from our fantastic panel members and also throw out a question, a big question about does social impact and impact in general need to be done through entrepreneurship? And are there models that make sense? And we have some amazing panel members who will talk about the investment angle, the scalability, and what should be the KPIs for this initiative. If you can get our slides up, please. So let me invite Mr. Ashim Roy, and he'll tell us about his background just in a few seconds, and then we'll introduce the other speakers.
Thank you, Ramesh. My name is Ashim Roy. I come from a company called Uber Diagnostics. My journey has been all over the world. In some ways, I started in India, and now I'm back in India after many, many years of spending time in Australia, Canada, and US. I'm working on a problem of healthcare.
Go ahead, Robert.
Yeah, I'm Robert Walker. I'm the CEO of Ravio, which is a company here in Silicon Valley. I've spent about 25 years in venture capital and in the LEDs for solid-state lighting, visible LEDs for solid-state lighting industry, which is transforming the way we do lighting. The mission of Ravio is to take that same technology into the ultraviolet part of the spectrum for water, surface, air disinfection to impact people's lives, and in particular, 3.4 million people, primarily children, die around the world every year due to infectious diseases in their water. The rise of superbugs and hospital-acquired infections is projected, if things don't change, to kill as many as 50 million people a year by 2050. And then also transforming access to clean water and better air for billions of consumers around the world by enabling the consumers to take control of their environment by themselves.
Sahil?
Hi, my name is Sahil Chanana. I work with the Millennium Alliance, which is a one-of-its-kind multi-country, multi-partner alliance where we support social entrepreneurs in the sectors of clean energy, healthcare, water and sanitation, and child and basic education. The alliance essentially has founding partners FICCI, the Government of India through Department of Science and Technology. It has the Government of the US through USAID. We have the UK Aid DFID agency involved with us, as well as the Wish Foundation and ICICI Foundation.
Excellent. Okay, so I think we live in a very confusing world where we're going to get care without going to hospitals. We're going to learn without building more schools. We're going to get food without necessarily depending on farms. And we're going to transact in currencies that are not mandated by governments. And so this transformation, is creating really new questions on what does it mean to have an impact, because we cannot just copy-paste the models that we understand in Silicon Valley or Boston and other areas and say, this is how teams are built, this is how entrepreneurship is done, this is how capital is raised, and so on. If you can go to the next slide. And so just to give you kind of my own background, I'm a faculty at MIT Media Lab, and I looked at problems like this where we have hundreds of millions of people, about 2.4 billion people who need glasses but don't have them. And that affects education, employment, literacy, and so on. And so if you go to the next slide, we come up with a solution a few years ago where you have a snap-on phone that goes in a binocular. You look through it, basically play a video game for about 30 seconds, and at the end of it, you get prescription for your eyeglasses, your nearsightedness, farsightedness, and astigmatism, and also can scan for your cataract. And so we spun it out. Thank you. So we spun it out as a venture, raised a lot of capital, and it's doing well. Nevertheless, that whole experience taught me that there are more than one ways to make an impact. So it's kind of my lab at MIT Media Lab. Everybody's having fun. They all have the toys. Next slide. But we thought, let's do it in a scalable way. And if you can just flip through the slides. I'm sorry, I don't have a clicker. Sorry, stop there. And we thought there are so many amazing problems that need to be solved, as Sally said. You might realize the problems, but you have to actually get your hands dirty. And if you just announce this as grand challenges, they don't go very far because we don't want to create contests because then only people who have time free from their hands would do it. Don't want a hackathon because that just builds a community. Don't want a degree program because then the incentives are different. Incubator accelerator assumes you have a team, assumes you know how to raise capital. And also we don't want to work purely with corporates. So go to the next slide. So what we have created through MIT, through our founding partners like TCS and Facebook and many others, is an innovation model where instead of worrying about entrepreneurship, innovation, CEO, CTO designations, we have a palette of grand challenges, and we have hundreds of innovators working together for a year in a well-paid internship where they work on these grand challenges. At the end of the year, through the year, they learn which teams they should work on, what problems are most interesting for them, what skills. And as Salih said, we want to create something that's at the scale of the next Aadhaar, the next UID, something that's transformational, something highly scalable. And so I encourage all of you to apply for this, participate. The next round starts in July. So that's the beautiful space. It's a multi-million-dollar center that's been set up. So I encourage all of you to think about this as a new model for making an impact. So let me hand it over to some of our panel members. If you can go one more slide. One more, sorry. All right. So, sorry, one back. So, if you think about innovations that would transform the unorganized sectors, can we create wearables that cost $1 that could change education, transportation, and hospitals by realizing the flow of people? Or how can we create smart objects so that we don't rely on systems that are built by governments or organizations that are very creaky, possibly corrupt, and possibly don't have a way to maintain them? How can we just create smart objects? Or how can we transform public health in a way that becomes very predictive? So you heard about cardio track, you heard about solutions in UV disinfection, you heard about alliances. Let me start with you, Sahil, and talk about, from an investor's point of view, how patient does one have to be to see an impact, and what should innovators and entrepreneurs in the space be looking at? If you go to the next slide, please.
I think, honestly, thank you, Ramesh. I think traditionally, investors have focused on three things, or if you look at the venture world, if you look at capital priorities ally themselves in terms of financial returns first, utility second, and the impact measurement or impact creation is third. But when you look at actually social entrepreneurship, the spectrum changes completely because impact creation is the number one objective. Utility comes second, and third comes financial returns. What has happened, though, traditionally, funds who invest in venture capital funds, or the fund of funds, so to speak, and institutional investors alike, those funds essentially they're about 5 to 7 years. When we look at, and when we talk about social entrepreneurship, we have to look at a period of at least 8 to 10 years, which is a minimum period essentially, which is required for an organization or an entrepreneur to come up, to scale up, and take his innovation or his invention essentially across the globe. What is happening, though, is that the institutional investors are also, they have this change in mindset where they're realizing that some of these innovations are very much scalable. And they're scalable to an extent where you said is that if it could be a low-cost solution. And I'll take a very small example of a company I met yesterday here who has this diabetes tracking system. And I said to them, I said, how much is it? And they said, well, it's going to be $600 for 6 months. So it was $100 a month. And I said, listen, if you tweak your business model a bit and you came to India or you came to if you came to some countries where diabetes is a major problem and you could bring your costs down to just a wearable device at, let's say, $10 or $8, you could have 100,000, 200,000 customers immediately out of the door. So they said, we've never really thought about that, but let us think about that and come back to you. So what I'm saying is that, the scalability aspect of it is something that investors are realizing. They're okay to live with it. And, ultimately, it is for social good. It is something that creates impact and makes the world a better place.
Very good point. I mean, talking about how do we make it scalable, how do we measure if we're going the right direction. I mean, Ashim, you're kind of the Dev Anand of impact and entrepreneurship, having done so many things, a lot of war stories. What do you think are the right way to measure? What is the equivalent of KPI when it comes to impact?
Okay, so we are working on this device called CardioTrack. This is a device designed for rural healthcare centers, primary care centers, where someone's ECG can be taken not away from home, and that information then can be shared across the net over to a cardiologist or a cardiac center typically found in much bigger cities. So as a result of that, the patient doesn't have to travel too far away from home. The impact that we are trying to create is that not only save lives, but save livelihoods. So just to explain what save livelihood means is that a lot of the times these patients would not go to a cardiac center. So as a result of that, what happens is that a chronic illness such as cardiovascular disease will continue to grow, and to a point where invasive procedure is the only way you can solve the problem. So at that point, the cost, particularly in India, I mean, it's a lot lower than here, but in India, typical cost of an invasive procedure is about $5,000. And that could very well be annual income of many of these people. And for us to be able to measure that impact is very, very difficult. All we can do is that try to bring the solution close to the community and let them benefit from it. However, to see how many invasive procedures we have stopped, that would be harder for us to do.
Absolutely. So on one hand, you're saying that don't bother me with metrics right in the beginning. At the same time, you're working on a very important problem. So
yes.
Is there a distinction between kind of qualitative versus quantitative metrics here?
Absolutely.
Or should a person in a classic venture model, you would start out with those right in the beginning? How would you address that?
So the way, of course, there are qualitative and quantitative measures. A typical quantitative measure could be that how many lives did we end up saving. A lot of the physicians in India, 99+% of the physicians in India don't have an ECG machine at their disposal. So as a result of that, a lot of the times a ECG scan, which is a non-invasive procedure, very simple to use procedure, is not taken. And that leads to a problem which can end up having many patients end up dying. In overall, globally, I think 18 million people die every year from cardiovascular disease, and a good number of them actually in India. So what we can measure easily is the number of people who could have been saved through the process of screening, but it's very hard to decide the qualitative aspects of it.
Good. I hope your investors also, I believe, in the important challenges that you have in specifying quantitatively what it could be. At the same time, the potential is huge.
Yeah, I hope so too.
Robert, I mean, you have done multiple entrepreneurial ventures, and you're working on this fantastic technology based on UV for disinfection. Tell us a little bit about how do you go from technology to something that could potentially impact millions of lives, and do you have to change your hat as the CEO, thinking about the financial aspect of it versus the impact aspects of it?
Yeah, so we have a fundamentally scalable technology in terms of the core technology that intersects between health and hygiene applications and traditional semiconductor manufacturing technologies. So I think we're all familiar that semiconductors are highly scalable, right? Mobile phones, computers, telecommunications, wireless communications have spread across the world now that even the poorest of the poor have access to mobile technologies and USB charging and all this sort of stuff, which was unimaginable 20 years ago. We bring that kind of a scalable technology into the health and hygiene space, where a device as small as the camera flash on your mobile phone could disinfect a personal water bottle that you carry with you. So anytime you get water, you could disinfect it in 30 seconds and know it's safe to drink. Or a family pitcher that could be solar charged, even in off-grid applications where you don't have access to grid power, to make sure that the water is safe to drink for families and children. Our challenge, specifically in scalability, is the ability to get to those end consumers. It's really, we're enabling never before possible applications that improve people's health and hygiene, but getting to those end consumers, whether they're urban consumers or off-grid consumers, whether they're in India or China or Kenya or Brazil, that last mile kind of problem, or last 10 miles or 100 miles, of the channels, the branding, and getting the message out. That's our biggest challenge. And there's companies that have solved that, whether it's Coca-Cola or Nokia or other companies that have, or Danone, that have already gotten to those consumers and have built those channels. It's really building those partnerships so we can get the technology into the hands of the consumers that need it. Because the most empowering thing about our technology is, here in the US, we have the benefit of generally clean air and clean water in our lives because the government does a pretty good job here in providing that infrastructure.
Absolutely.
In so many regions of the world, governments either can't or won't, in many cases can't. They just can't get to the scale to provide that infrastructure of safety for their citizens. And by empowering the consumers themselves to bring it into their own lives, that I think is the most empowering thing we do.
That's great. So I hope many of you will get to meet the panelists. To wrap up, I mean, Salil, you and I are coming at it from, enabling in parallel many innovators and many entrepreneurs, and we have two entrepreneurs here who have done it in series. So kind of we have a parallel approach and a serial approach here on the stage. So just to wrap up, final thoughts. So this whole notion that if you have to have an impact, is it important to start with entrepreneurship? Or is it better to start with innovation and remove the technology risk and adoption risk first, and then start worrying about the entrepreneurial aspect of it? Just quick thoughts, starting with you.
I think it's a very well thought out proposition that you have. The idea that you are implementing in NASIC is a good one. I feel that takes away a lot of the risk that investors will feel is there in the system, and doing so, it actually helps everyone.
Although I'm a technologist at heart, I think starting with too many companies I've seen as a venture capitalist start with the technology and then try to find an application. I think you want to start with the problem that the consumer or the business or whoever your customer is has in their lives, and then work it back. Here's the problem. How do you solve that problem? And rather than a technology looking for a market, you want to start with a market application and then look back to how you solve it.
Salil, final thoughts?
I think I agree with Robert. I think two things that social entrepreneurs should keep in mind is, one is that what is the nature of the impact that they're creating, and second is what is the efficiency of the delivery of that impact that they're creating. That's it.
Okay, thank you everyone,
Thank
and
you.
see you around.